and happy Wednesday. Thank you for joining us for another Facebook Live. So, sometimes during the week, I just kind of start thinking, I think this is what we'll talk about this Wednesday. Now, last week we talked about the procedures that we do for women and how they felt, and today we're going to focus a little bit more on the men. But I also was looking at my legs on multiple occasions over the weekend thinking, I think I could work a little bit on this. So my part will be I will have to go to the gym so I can start lifting more so that I can build up that muscle mass that I kind of may have lost just a little bit underneath my skin, because my muscle mass gives a lot of structure to my overlying skin to hold on to. But I know my skin is also changing in particular areas. Now, there was one time when we were in the office and we did our secret demo that I secreted one leg and not the other. So on repetitive occasions over this weekend, I've looked at my legs and pulled up and gone down. And I'm like, this leg is so much better than this leg, and this leg deserves the love of this leg. So today, while I talk about the boy procedures, I'm going to secret my legs to show you it's not horrible. You can adjust things, and I'll talk a little bit more about that procedure after I talk about the supplement of the day, and then I'll touch base a little bit of the secret, and I'm going to show you what I've done so far. It's kind of like a cooking show, but I'll show you how I've prepared my legs, and then I'll show you kind of how I prepared for the procedure, and then you can watch me do the procedure. And I love multitasking like any person loves, and so I might as well do the secret while I'm talking to you about other procedures that we have. So what an exciting day. And we're so thankful that everyone, with all the storms that went through yesterday, are doing all right, and it just kind of gives you another opportunity to be thankful for things in life that we may so much take for granted. And so we're just thinking a lot about people that were affected by those storms, and hopefully we're all a little bit more thankful ourselves for the fact that we just got to have a day today. So without further ado, let's talk about the supplement of the day. So again, I'm touching base on collagen, and let's look at our two collagen products. We have our Simple Elements Rejuvenation and Skin Formula, and then you also have plain collagen. And the reason that I was highlighting these products are, if you're going to do a procedure to your body, you might as well also have a topical, the collagen, as well as the procedure, because this stuff helps inside out. This helps the actual tissue. And then as far as the topical that you put on top, it's like Miracle-Gro from the outside. So you have the 3 levels of awesomeness to help get the best results from whatever procedure you do. So the skin and hair formula they both have collagen in them, so they're both alike in that, although they're made from different manufacturers. And so the great thing about both these products is not only does it help with skin collagen, this one says it's for musculoskeletal health, but it's really for all collagen of the body, but it also helps with gastrointestinal health. And we know our skin is an excretory organ, so our skin gets better when our stomach gets better. And those are like products of both of these. Now this one is just kind of like a powder you could put in your smoothie or water, and this one you could put like 1 teaspoon in, or I think it's 1 tablespoon, 1 heaping tablespoon, and 8 to 12 ounces of fluid. And this one also has a little glucosamine in it, some L-glutamine powder for gastrointestinal health, aloe vera, and bamboo extract, as well as biotin and vitamin C. Now this one has a little bit of magnesium, it also has some vitamin C, and it has kind of 3 different types of collagen in it. So I think both products are amazing, but would say if you wanted a little bit more hair growth, you wanted some biotin, etc., maybe do this one. But if we're looking for collagen regeneration strictly of skin as well as gastrointestinal health, certainly feel free to do this one. So just know, again, these are the 2 supplements I was talking about today to help your body with skin health inside out.
What is the proper age to begin using these?
Using these? Oh my gosh, you could use these anytime. Now what would happen is hair growth tends to go down when we're stressed out. So if someone gets stressed out, or if they have gastric, like food allergies, food sensitivities, and just wanted something that might help their skin and their gut get better, you could do this at any age. But when we start aging, definitely, I think like at 35, 40, you really start to look at your skin and say, it's a little different now than it used to be. So you could certainly fire these up at that point in time. But food allergies, food sensitivities, hair growth at any time in life, although those factors tend to be a little bit more increased as we age, specifically over the age of 35. So I would say you could do it anytime, but definitely over 35. Any other questions? Okay, cool. So I'm going to put these down now. So then I'm talking about the secret device. So with the secret device, this is the machine, and I love it because it combines microneedling and radio frequency. So it's 2 awesome modalities of treatment to skin in one, and it's called the secret because it's a secret that you did it, that you don't really have any downtime, and no one knows that you did anything. And people love that because now people love to spend time going to see movies, having fun with their families, with themselves at events. They don't want downtime of procedures, but they want the amazing results of the procedures. So this particular device really meets people in the middle, and they've really had a lot of success with it. So a lot of times when we think of skin procedures, we think solely of our beautiful face and necks, of which this does an amazing job for, but I'm going to use it a little bit in a different realm of use today, and that is for more kind of cellulite appearance of skin, because this also works amazing for stretch marks as well as some cellulite. So let me show you some pictures of results that have come about using this procedure, and then I'll kind of walk you through what I'm doing to myself today, and then we'll get to the boy procedures. Okay, so stretch marks. So stretch marks, I don't know if you can see this or not, but stretch marks happen because our body stretches, and specifically in a woman's body that happens a lot of times in pregnancy, but both men and women have that with weight fluctuation and changes. And so what this particular device is you put it over the stretch marks, and you basically fill in the stretch marks over time with healthy skin, and they go away. And it's just so fun to be able to have a procedure that's not horribly painful by any means, actually help that part of our body heal up. So not everyone wants to get rid of their stretch marks, and that's great, but if you wanted to, this is a very straightforward way at being successful. So
Could you do it in between pregnancies?
you totally can. Now, you may get more stretch marks in the second, pregnancy or the third pregnancy, but the closer to acquiring the stretch marks you treat your body, the more effective the results oftentimes you get, because chronic healing is a little harder than acute healing, if that makes sense. So then let's get to the cellulite pictures. Because the cellulite pictures, look at that! This is our tuchus! And so you can see all the little dimples of your bottom, and then this is after 3 treatments, how they went away. And this is another picture of someone's bottom after 3 treatments. So as a fellow female, this is just fun to know that this is super attainable. So besides thinking of your beautiful face and your neck, don't forget stretch marks and cellulite. So then this is a picture of another patient that has done 3 treatments of her face. There's no filler, there's no Botox or neurotoxin involved, and there's been such a reduction in wrinkles. Her neck looks totally different, so it's just really cool to know this device is out there and it works well. So I'm going to put these down. So then when you think of my legs, I already put local numbing medicine on the front of both legs, because that's the area that I'm going to treat. And specifically when I look at my legs in the mirror, I'm like, when I'm sitting on the toilet actually looking at my legs, stretching them back, it's this area in here that I really wanted to focus on. But when I stand up, the other thing that happens is the skin goes down and it gets more wrinkly right in here, so I'm going to treat that as well. When I first did this leg, I thought, oh my gosh, if I treat up here, it'll like pull it up. But I really realized that I really want to treat those wrinkles a little bit more themselves, and that's what really helps them go away. So I have local numbing medicine on both legs. Then I take my little baby wipe, because if you have a whole bunch of cream on your legs and you do this, the little prong things get they get stuck. So I'm just wiping it off. Go ahead.
As you're wiping it, somebody had a question about
Yeah.
the names of the 2 products you showed.
Yes.
The 2.
Oh yeah, the collagen or the hair, skin, nails.
Mhm.
Yep. So the collagen is an orthomolecular collagen product, and again, it works really well. The simple elements is just we private labeled a Designs for Health product that is their kind of hair, skin, and nails formula. So it's just called Rejuvenation Hair and Skin Formula, because you're rejuvenating your awesome hair and skin, because your body always wants to keep getting better, and that's so fun. I'm going to leave this leg a little bit more, the numbing cream, I'm not going to wipe all of it off, because gosh love it, it's going to take me a little while to get over there. And then take a little alcohol and I go over it again, just because I want to get any residual stuff off, or else the little things, I'll show you, they get stuck on they start sticking. I think this little setup is kind of fun, because it's almost like I'm driving one of those car video games and my foot is the foot pedal. It's just kind of cool. Okay. So the secret is cool, because I can apply the intensity, the radio frequency, the depth to multiple areas of the body and treat them individually. So you can get different results depending on what patients want in the different areas of the body that work, because not one size fits all. So I love that too. I love the ability to be a little bit more artistic. So this is the handpiece, and this particular one is the 64 kind of prong one, and you can see all the little micro needles in it, and it's semi-insulated because the radio frequency will be delivered underneath my epidermis into the dermis. So all you do basically is you just kind of stamp it as you go along. So I'm going to kind of activate it, and then I'm going to go like this to start with, because I always like to know what it's going to feel like to start with, and turn it up as I get going. You just got to get used to it for a second. So I step on my foot pedal here. I'm going to see, it doesn't hurt at all. And I hope I can talk it. I'm going to probably get started going on this, and then I'll have to kind of talk as I move along. Radio frequency, I'm going to time. I'm going to make it 80 depth. I'm going to go a little deeper. Why not? Okay. And so I'm going to do it again. Cool, so fun. Okay, so I may kind of talk and do this a little bit at the same time, because I might get a little distracted. So the first thing I think we're going to talk about for the boys, but maybe before I do that, I'm going to just make one single line down. It goes fast. I got to really concentrate. Turn it down just a bit. Smells like burning flesh. Doesn't it kind of? It's not every day on a Wednesday afternoon you secret your legs. Sometimes we'll shave, and well, today we're secreting.
Question, how long does it take to see results, and how long do these results last?
So it can take like up to 4 to 12 weeks to really see results. But the results should last as long as it takes for your collagen to break back down. You know, when you do this to your face is constantly exposed to the sun. So the more sunscreen you use, the more you keep your face out of the sun, the longer your results will last. It kind of is user dependent, if you will. So you could do this as many times as you want to, or as few times as you need it. So you normally do it 3 times over to the particular area, about a month apart from each other. But as far as if you ever needed to do it again, or how many times you need to do it again, that's very individualized. Oh, it's so cool. Okay. You just kind of start getting used to it after you do it for a little while. Now I could talk a little bit more. Okay, cool. And so you can see on the inside of my leg, it's starting to just make little grids where I've gone. And so I tend to get a little bit red when I've treated myself in certain areas, so that's why it starts getting red. So some people get red, some people don't. So when I think about this, it's just like having just some little needles kind of touch your leg. It's not like, oh, or anything like that. So when I do CO2 to my leg, that would be a little bit more snappy. But the result, that is, you don't really like to do a lot of CO2 in the summertime, because our skin is out in the sun, and that is kind of causing a bit of a burn. So you don't want to injure your skin where you cause scarring. You actually just want to promote healing of your skin. So you just want to be more controlled about the amount of damage that you do to your skin to promote health as opposed to injury. So the other thing we'll talk about again is laser hair removal for those beautiful boys. And so, summer coming up, where would we do laser hair removal for a lot of men is actually either their chest and or their back, the back being a little bit more popular. When you think about it, some guys have tattoos in various areas. You can't laser hair removal over the tattoos, because the laser hair removal is targeting the dark pigment in skin, and so if you go over dark pigment, it actually would burn. But we have some speed gel, and it makes laser hair removal of the back actually go really, really quickly. I think Carson did a patient in like less than 10 minutes. So can you imagine that? You don't have to have a friend, a family member, your significant other, your wife shave your back. It's already taken care of, and you don't have to feel nervous about having, not that a hairy back is uncool, but you don't have to feel nervous about that or finding somebody to help you out. So it's easy and it's affordable. The other thing, of course, don't forget about Shockwave Therapy. Shockwave Therapy, or trade name Gainswave, for erectile dysfunction. So we use that particular device, which maybe we'll highlight on one of the other shows, to do both erectile dysfunction as well as soft tissue repair. So a lot of Achilles tendon injuries or plantar fasciitis, I've done like another patient who's an athlete that has a lot of knee issues, and he's had some really great results, and I'm super excited for him. And so normally when I do any sort of shockwave therapy, it's 2 treatments in a week for a total of 6 treatments. And then let's see, and the other thing for boys I would talk about is cool sculpting. So with cool sculpting, the 2 particular areas for boys that might have more than anything else would be flanks as well as man boobs. And so we don't treat women's breasts, but we do treat men's breasts. And so how many times do some people not want to take their shirt off because they're nervous about that, but that's something we could totally help. And then the reason men have more fat on their flanks is we have until the age of 20 to put on body fat cells on our body. And after we're 20, those body fat cells that are subcutaneous, meaning they're just right under the skin surface, get bigger and smaller until you liposuction them, you cool sculpt them, or when you lose weight, they just deflate, but not until you actually make the cell fall apart will they never come back. So over the age of 20, if you do liposuction or cool sculpting, you can't put fat back in the same area because you lose the biological capacity to do so. So men a lot of times put fat back here, and so that is why we do a lot of flanks and breasts, because as we age, everyone's been through a little life adventure, myself included. And your body, when you have more life adventures or stress, protects you by increasing body fat, reducing muscle mass. And so when you wake up and feel like you want to connect with yourself a little more, we have these, not battle wounds, but memories of where we've been. And so a lot of times we become very motivated to change those memories so you feel reconnected within your own self. So I would say for guys, and also for guys, we can still do neurotoxin like Botox or Xeomin or any other neurotoxin we use. Guys tend to use a little bit more than women do because they've got bigger muscles than we do a lot of times. So you have to just be mindful of that when you're treating somebody. But a lot of guys like to maintain expression in their forehead. Not to say every man does. So you just have to, I just try to be mindful of that so they don't feel like they're expressionless if they don't want to be. And you can modulate how much you put in to achieve that result for people. So I would say those would be the 3 procedures that come to mind most for men that we see. But certainly if you have any questions, let us know. So I'm going to continue to keep treating myself with this, because if I stop, my leg's going to stop being numb, and then it will be uncomfortable. So if you have questions, keep sending them in, and then I can answer them as I go along, because it totally distracts my mind, and you know how I love to talk. Okay, so I'm going to keep going. And I'll talk as I go along. And Lauren, if any questions come by, just let me know and we will rock this. And then I can also talk about the donut thing. So the other thing is we have Saturday is National Donuts Day. And so we have some fun people in town that make amazing breakfast and donuts. And I think she also does lunch and serves other types of foods in a restaurant. So she's going to bring some donuts by, because you know what's awesome about Donut Day? It's a splurge day. And while we talk to people about wellness, splurging, having fun with family and friends is an important part of being human. So you know what? We might just eat a donut on Friday, but also we may have a wellness talk at her restaurant, so we can kind of talk about other things there, because we're all about wellness and trying to send that message to people. So we'll figure out the exact day we're going to be there. I don't know exactly when it will be, but the donuts we shall have on Friday, I think, maybe. So we're excited. What? Oh, and then the Circle S Ranch. We get to go to the Circle S Ranch again at the end of June, and we're super excited about that. It's a really nice getaway for people to get away from the hustle and bustle of normal life and just go out and have fun. And I was telling another patient earlier today, last time we went, my son, who's learning to drive, drove me out there, and he said, "Mom, why does anyone want to come out away from town?" And I was like, "Oh, buddy, you forget the whole point of it. That's the whole point, to get away, to maybe put your cell phone down." And let me tell you, there's no cell service where we were at while he was sitting in the car, and he read the manual to the car. So he knows everything about that car now. And he just sat there for an hour and a half and read the manual. I was very proud of him for being self-sufficient in that time. So I'm going to start back again here. And again, if you have any questions, let me know. I can tell the areas of my leg that I've numbed up more than others. It's so fun. But you can see how fast this goes. And how long it took me to get all this stuff with my legs, but how fast I can actually reverse it. I think that's so fun. And for me, I notice on my, sorry, my foot fell off the foot pedal. But I know that I have a little bit more issue on the inside of my leg, so I may tend to do more passes in there. And so the areas that I want to treat more, I do more passes on.
Now the inside of my leg also tends to be a little bit more sensitive than the outside of my leg, so I'll be a little bolder out here just because I don't feel it as much, and it's not horrible by any means. And the longer I go, the more used to it I become. I have a very staunch startle reflex, so sometimes I go, ugh, it's not because it hurt or anything, it's just because I wasn't expecting it. So now I'm going to go around. Now, when I get around my knee, there's less subcutaneous tissue, so it just gets a little bit more tender, but that's okay. It's all good. Plus, I think, again, I was inconsistent about how
A question about scars. What
Yeah.
if you have a scar?
Yeah, this
On an
totally works
area.
over scars.
Can it be done over a scar?
Yep. Because the scar is the same thing as like cellulite stretch marks in a way. It's a change of the skin contour. So our skin is amazing. Sometimes if I cut all the way through the skin, I will stimulate scarring and fibrosis. But your skin, if you stay above the basement membrane and stimulate injury, stimulates healing. So if I've cut through your skin, basically what I do is we keep going over the scar and your healthy tissue grows outside in. So this works really great for scars, as does the CO2. So if I wanted, the difference of what I would use for is if I have like a C-section scar and that's all I have, and that's all I want to treat, I might tend to use the CO2 a little bit more than this, because I can be a little bit more focused and it's a little bit more cost effective because I don't have the cost of this reusable device. But if I'm going to come in and say, oh, I'm going to treat my C-section scar and my face, then this is awesome because you just add that on at the bottom and you can already use the head for that. So I just try to individualize that towards the patient, but scars are actually pretty straightforward to go away. Now the exception is if you keloid, and keloid is where you get that mound of tissue to any injury, and those are kind of special cases. Good. My foot keeps falling off. Now my leg will look like a cat scratched me for like a week or so. It'll just look red and kind of hot for a little while today, but then the next few days it'll just look like I have a lot of scratches on it. But right now you won't be able to see, and I'm just gonna I'll put some cream on after this and walk around, but I don't have to worry that I'm gonna get some crazy skin infection on my leg or anything like that after I'm done with this. So it's not near as ablative as like a CO2 where I wouldn't put anything on my skin after I did that. I also think of the tip of this device kind of like Wolverine. The adamantium and his little spikes. But I tell you, I really love the results as I have looked at this left leg, because I've already treated my left leg once, but I haven't done my right leg, so I'm excited for that.
Can you go swimming? Is another question.
Like right after I did this, I wouldn't go swimming like probably like the day that I did this, and it will look like if you go to the pool, if I have my own pool in my backyard, I totally swim after a couple of days, honestly. You know, swimming, I wouldn't probably go to the lake water and swim because you made a lot of little holes in your skin, and lake water is super gross. But I'd totally swim after 7 days in the lake water. But in pool water, it'd be totally fine to swim after a couple of days. It's just going to look weird. So when you go to the pool, if you went to like the public swimming pool and swim, people would think that you had a really aggressive cat that attacked you, which you might not care about explaining that. But if you didn't want to explain that, you're not going to get at least an infection. You can shower and sit in the bathtub and stuff like that. That's super fine. Oh, and don't forget about Dr. Ma's study. That's coming up. So if anyone wants to sign up for that, you get some money off your treatment. You get topicals afterwards. We should be starting that whenever those products come in, and that's really exciting. Again, Dr. Ma is a PhD, and his team, they're from Ohio, and have patented MG53, which is a protein that helps cells heal after they've been acutely injured. So we're trying to establish and show that you have enhanced collagen benefit after any treatment. When you put that special cream on afterwards, that's improved over baseline. So we're really excited to be part of that study. And if that intrigues you, then let us know, because there's still some few spots open. And if this gets too boring, we can just
There was a question
cut off
about
at any
the
time.
shockwave therapy for
Yeah.
sexual function
yes.
and how that can be done, and when is it safe to have sex after that?
Absolutely. So shockwave therapy can be used for both women and for men. So for women, I put it up and arc up behind where the G spot is, just inside the vagina. Do both the labia through pudendals, which are these nerves that come out at the base of our kind of perineum, as well as the clitoris. And so that helps with our sensation externally. Now, there is no downtime after you do that for a female. You could go have sex right away if you wanted to. The neurological benefits may take a little bit more time to come effect. Now, for a male, absolutely zero downtime. You could go have sex right after you're done if you want to. And a lot of times you'll notice improved vascular flow, which is the key for erectile function. 80% of erectile function or erectile dysfunction in men has to do with vascular flow. 20% is neurological, or how we're thinking. So when your penis works and you don't have to think about it, people get happy. So there's actually two different ways that I could treat and do a shockwave therapy. I could do one that has like the standard 14,000 waves, or I could increase that and treat it a little longer, and sometimes do it for a little bit more performance, if you will. So if somebody had some special event that night that they're wanting like super amazing stuff, then we can totally target that as well. So there's lots of different treatment protocols that we have depending on the patient and what their desired benefits would be. And there's no incision, again, there's no downtime, there's no change in your ability to urinate, so you don't even know that we did it actually, other than it works a little bit better. And people find that exciting. What time is it? 4:27. Well, how about this? I'm going to continue secreting my leg, and I'm going to keep taking pictures of what my leg looks like on my phone, because last time I Botoxed my face, people liked watching what happened over those 7 days. So I'll take pictures of what my legs look like every day when I'm waking up and looking at them, so you can see what happens. Now at 7 days, you're probably not going to see that, oh, her legs look so dramatically different. But in about a week, and not a week, a month, you're going to start to notice that this inside of my leg is looking a little bit more taut. And that's the desired effect. So I'll keep you aware of those and keep taking pictures, and we'll post those as they're available. And I hope you guys have a great day. And if you have any questions, never hesitate to call out and let us know. I'm going to continue to do this to my leg, and I hope you have a great day.